Well, let's focus on health matters now, and in a new report, Discovery Health have shared the first detailed analysis of the Omicron outbreak in South Africa. Reporter Heidi Giokos has been monitoring that situation and joins me now for an update. And so, Heidi, all along we've been saying that a lot of what we needed to know about the Omicron variant was up in the air. In fact, the phrase was, what we know is that we don't know much at this point. Well, we now know a substantial amount of information. What exactly do we know about the Omicron variant from what Discovery has told us?
Yes, I think this is groundbreaking data and analysis that has come through from Discovery Health, given the fact that we have constantly been told it's still early days, there isn't much new information out yet, it's still very difficult to tell the severity of Omicron. There were early indications that it's not as severe as previous variants and previous waves, and that's clearly in the numbers. Tulas, we do know it's a highly transmissible variant, but the big question is it a dangerous variant? Does it cause severe infection? Does it cause death? Is it a deadly variant? And according to the analysis by Discovery Health, it seems as though it's a lot milder. So yes, there is hospitalization. It's mostly in the unvaccinated. Yes, there is a high possibility of reinfection, especially if you have been infected with previous variants, but it's a lot milder because people have been vaccinated. The big breakthrough, though, Tulas, is whether or not the vaccines that are currently being administered work against the Omicron variant. So Discovery has been able to do analysis regarding the Pfizer vaccine, and some of the information that has come out is that vaccine effectiveness of the double-dose Pfizer vaccine has reduced from 80% in Delta wave to 33% in Omicron when it comes to reinfection. So previously you were protected 80% in Delta, now it's 33% in Omicron for reinfection. The big one that health experts and the Department of Health, even the NCCC, look out for is what is happening in our hospitals and how these vaccines are working. We know vaccine effectiveness of the double dose of Pfizer vaccine has reduced from 93% during the Delta wave, that was our third wave, to 70% in Omicron wave against severe complications of COVID-19, which is hospital admissions. There is still some protection. It's 70% protection against severe COVID-19 and hospitalization. Yes, it's dropped down from 93% in the previous wave, but Discovery Health says this is promising information. They were worried there was going to be no kind of effectiveness against severe hospitalization. And this is also why, Tulas, there's been an urgency for booster shots, because the booster shots will hopefully push up that effectiveness to over 90% again against severe hospitalization. But let's listen to Discovery Health on this matter.
The epidemiological tracking shows a steep trajectory of new infections, indicating very rapid spread. This is clearly a highly contagious variant of SARS-CoV-2. What's encouraging at this stage is a flatter trajectory of hospital admissions, indicating likely lower severity of this wave. Anecdotal observations have demonstrated quite nuanced differences in the clinical features of Omicron, both in and out of hospital. And these anecdotes, importantly, support the data analysis and correlate with what we're seeing in the data analysis. The data indicates that the severity of Omicron is 29% lower than what was experienced in the D614G wave, or the first wave here in South Africa of COVID-19 infections. This severity is encouraging, this reduction in severity.
So Heidi, the specifics that we've been discussing in terms of the impact of the Omicron variant on effectiveness of vaccines, those specifics we've been talking about have to do with the Pfizer double shot vaccine. We know that in our country, the other vaccine we use is the J&J, until now single shot, but now having those who got it under Sisonke study getting a booster shot. Do we know anything, did anything emerge from the briefing about what the impact is of Omicron on the effectiveness of that particular vaccine, the J&J one?
It's a brilliant question, and it's important for South Africans to try and understand the effectiveness of Johnson & Johnson against Omicron. But it seems as though, Thulas, there are still trials underway. What's interesting, though, is that Professor Glenda Gray, who heads up the Sisonke trial, did make it very clear that nobody has died of Omicron that's been vaccinated by Johnson & Johnson so far in the trials that they have analyzed. So that is some comforting news. We do presume that there is some kind of protection against severe infection of COVID-19 when it comes to the Omicron variants, but it's still early days, like all health experts have been indicating. So Discovery Health, of course, analyzing information and data that they are exposed to, and they have that information before them. That's why it becomes very difficult for them to do anything on Johnson & Johnson, and hopefully the Sisonke trial team will be able to provide further clarity on that. But I think there is good news that nobody has yet died of Omicron, especially when it comes to the Johnson & Johnson trials. Hopefully there'll be more information coming through in the coming days, and it will be a clearer picture. But so far, Thulas, there is some positivity out of all of this, that it's not as severe as Delta, and people aren't in desperate need of oxygen or ventilators like we saw with the third wave.
Yeah, that's certainly been the experience even from the hospital groups. They did report that only 10%, I think, was the report from Netcare. Only 10% of the people that they had, I think last week, needed some kind of oxygen. 90% didn't need oxygen. Lastly, Heidi, for my benefit, let me take advantage of the fact that you are of proud Greek heritage. We've been talking about Alpha, Beta, Delta. Now we're at Omicron. There's a nice way in which you say it that is not Anglo-Saxon in its way. How are we supposed to be saying it?
Omicron.
Listen to you.
Omicron.
All right, Heidi. Thank you.
Hopefully there's no more Greek alphabets that we use. Hopefully this is the last variant.
That would be great, absolutely. Heidi Giokos, always tracking that story for you in as far as the COVID-19 situation, vaccinations, the new science. You always have to make Heidi your first point of call in terms of finding out what's coming out from the world of science around this disease.